Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. Alright, so today's questions are all about the penis. First question, what is the normal size of a penis? Very good question, very popular question. So when you are through puberty, so puberty completed, we're not talking before puberty, we're talking after puberty, the normal size of a penis is going to be on average 3 to 5 inches when it's flaccid, meaning not erect, and 5 to 7 inches when erect. This is an average. Everybody is different. The thing to note about measuring length of the penis is you actually, if you really want to measure how long your penis is, you measure from the base of your pubic bone. So not where your testicles start, but feel the bone underneath and start there and then measure to the tip. Second question, when do penises start and stop growing? Again, everybody is going to be a little bit different on this one, but keep in mind, penises grow over years, like 3 or 4 years. So generally speaking, puberty and penis growth starts on average around 11 and a half for males. The thing to remember is that this can be earlier or later for people, and penises are not the first sign of puberty. It's actually testicle growth. So you're going to see testicle enlargement or feel testicle enlargement followed by penis growth, and the penis growth again extends over years, so throughout puberty. So on average, again, starting around 11 and a half and usually ending around 15 or so. Next question. 17-year-old. My foreskin is attached to the head of the penis and I'm uncomfortable about it. It's like a skin bridge and it's been there my whole life. So this is something that you may have heard called the banjo string. It's a natural bridge connection on the underside of the penis that connects the foreskin to the tip of the head of the penis. Not the tip, but the head of the penis. And if it is torn, it can hurt a lot. And the problem is that if it does tear, or if you want it to tear, it can actually heal and be a little bit tighter, so you kind of don't want to mess with the banjo string. If you do tear it, keep in mind, you want to let it heal, meaning try not to do any sort of masturbation or sexual intercourse until it completely heals. It can take anywhere from a couple of days to a couple of weeks, so your body will tell you when it's ready. Listen, feel, and if it hurts, if it bleeds, it's probably not totally healed yet. Again, if you don't let it totally heal, it can scar, so it's kind of a big deal. Next question, how should I wash my penis? I suspect this one is probably from someone who is uncircumcised. The circumcised penis is going to be one that the foreskin has been removed. This is a disclaimer. I'm not advocating for or against circumcision. I am just speaking to teenagers who have either a circumcised penis or an uncircumcised penis. Circumcised penises, again, will have that extra skin that covers the shaft of the penis that's been removed usually at birth or around the time of birth. Uncircumcised means that skin is still there, and it can hang over and cover the head of the penis, and then usually when erect, that foreskin retracts or pulls back. It's also important to know that as you go through puberty, if you aren't already able to pull down the foreskin, you should be able, as things grow, to retract that foreskin and pull it down beyond, past the head of the penis. In the shower, so maybe once a day, it's a good practice to pull down the foreskin and clean with a gentle soap and water, and then rinse off completely, and then pull the foreskin back over the head of the penis. If you are ever in a situation where you cannot get that foreskin back over the head, that is an emergency and you do need to be seen by a doctor. And last question, is being a grower normal? For example, having a 2-inch or smaller penis when soft and then 4 to 5 inches when erect. Yes, there are growers and there are showers. Growers are ones that maybe the flaccid penis doesn't look super big, and then when erect, enough blood flow goes to the penis that the penis actually is pretty large. So that's a grower. Versus a shower is one who already is pretty big at baseline. So when it's flaccid, it's pretty big, and then when it's erect, it's, a little bit bigger. So either one is absolutely fine. Whatever you are, totally normal. So these have been 5 questions related to the penis. I hope you got your answer. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.